All right. Good evening. Welcome again to the first board meeting of the year. We'll call open session to order. Legal counsel, if you want to read us actions out of the closed session.
Sure. Thank you, Chair McGarry. There were 3 items considered in closed session. The first, I would refer everyone to the agenda, 6.1. That item was denied by the board on a 5-0 vote. Item 6.2, which were 3 separate closed session minutes, those minutes were approved, also on a 5-0 vote. And lastly, medical staff credentialing under Health and Safety Code 32155. Those recommended credentialing decisions were also approved on a 5-0 vote. That concludes my report.
Fantastic. Thank you. Item 10, any deletions or corrections to the posted agenda? Any from the audience? No? Any input from the Employee Association?
We need to do general audience input first before the Employee Association? Under 11?
I apologize, I did that quietly.
Yep.
Yeah, I was mumbling. I'll speak louder. Medical Staff Executive Committee.
Sorry. Chair, item 11, did we do item 11?
I did. I asked. I think I pointed the audience to any input.
And then she said the Employee Association.
So is there any public input, general public comment?
So, that was what you were talking about?
That's what I'm
How
talking
did that came after this?
No, number 11.
She wants to give it, so he's trying to make.
Oh, I'm sorry.
Oh.
So this is Johanna Koch speaking, and I am here to ask that the board consider supporting or even driving a public awareness campaign, if you will, about how the hospital will respond to undocumented people who seek care in our hospital district. Because as a bilingual practitioner, I'm already seeing patients who've told me they won't be coming back to my clinic because they're afraid. And I want our communities to know where we stand and what is legal, what is the law, and how we're going to follow the law, how we would respond if ICE showed up at our door.
Thank you. Obviously, a lot going on with the change in administration. And a great suggestion.
Yeah. And pass it back to staff. They just send it to staff to take care of.
Thank you, David, for pointing out that I missed my opportunity to speak. So next is the Medical Executive Committee report.
Yes, please. Thank you.
All right. And so now as the Chief of Staff, I have, can you hear me okay?
Yes.
Okay. There are 2 policies to discuss today. One is a revision to our medical staff and allied health professional staff immunization and vaccination requirements. And we have removed COVID as a required vaccine, which is the state policy, and so we're simply adjusting to comply with the state requirements. And then the second is a policy that we have about policies.
That's my favorite one.
Had to just get that in there, which is that if we have 2 policies that overlap and conflict, that we have a resolution mechanism, which is that somebody from each policy will sit down and talk about it and come up with a policy that's consistent for both. I mean, an example of that is doing upper endoscopies as a general surgeon versus doing upper endoscopies as a gastroenterologist. If the 2 policies are actually written differently, then we need to standardize them, and so the 2 of the departments would sit down and discuss how to have the policies be identical so that the staff working with them wouldn't be doing things incorrectly. Yeah. And that's it for the open session policy review for the board. Questions?
Thank you very much. Yeah, any questions from the board?
Have we come up with any that have been an issue, or are we, as things evolve, that will be seen?
This is a long-standing policy, and we just had to renew it.
Okay.
Yeah, and we didn't make any changes with it.
Okay.
And so there have been some examples where this has been utilized, but nothing recent.
Right.
Yeah.
Any other Questions? Any questions from the audience, public comment? All right, with that, can we have a motion to approve the MEC consent agenda?
I move that we approve the Medical Executive Committee meeting consent agenda as presented.
I second.
All in favor?
Aye.
Aye.
All opposed? All right, motion approved, 5-0. Thank you very much, Dr. Coe. Next is the consent calendar. These are items that are expected to be routine, non-controversial. Any items to be pulled or any items to be discussed? I just had a quick comment on the CMO board report, something that I thought was pretty cool. Every year, medical staff, my understanding through the report, gets a small gift in appreciation. The medical staff this year opted to take the funds that would be dedicated to that and instead direct it towards charities in the community, which I thought was absolutely fantastic. I just wanted to pull that out of the report and recognize it publicly, because I thought that was, please, yeah.
Yeah, thanks for mentioning that. I feel that the decision to forego gifts for the holidays was a really big one. A lot of the medical staff appreciate the gifts and they appreciate the gesture that is, but they really wanted to use the funds to improve our community rather than get another Yeti mug or something along those lines, because they probably already have several of those at home. And so we've already gotten a lot of thank you cards and notes from people who have benefited directly from those funds. In particular, some students from the high schools, both in Incline as well as in Truckee, who've been able to attend an anatomy lab. And these are people who are potentially going to go into healthcare as a profession in their future lives. And that was not something that was going to be done or possible without those funds being contributed. Sarah's been very involved in that as well. So I want to thank her for coordinating a lot of that activity. But it really just kind of shows you the kind of medical staff that we have at Tahoe Forest. Thanks.
Absolutely.
Thank you.
Wow. All right. We need a motion then to approve the consent calendar?
Sure. I make a motion to approve the consent calendar.
I'll second.
All in favor?
Aye.
All opposed? All right, motion approved, 5-0. Next item, this is items for board discussion. Typically, we get in the consent calendar, we get a board report from the administrative staff. We're going to try something a little bit new. I think it's actually something that these reports used to be presented by everyone on a regular basis, and that proved to be pretty cumbersome. So we're going to pull out one, maybe every other meeting. We're kind of working through what that might look like. Jan was kind enough to either volunteer or was maybe voluntold, I'm not sure which it was, to be our first. The intent here, some of the feedback that we've received, definitely in the past year and even years past, was that there oftentimes wasn't really a direct channel to share with the board, to share items of concern. The intent here is obviously not to air dirty laundry or to get into what would be more management discussions. But if there are topics, even on a national basis, nursing shortages, those types of things that are relevant and important for the board to hear about, we just wanted to create a forum for that. So that's the intent of pulling these reports out. So thank you for joining us tonight.
Thank you, Chair. So I will talk about some of the great things that are going on in nursing at this point. And like I said, there is some areas where we could maybe see some area of improvement. Oh, my clicker. Is it on?
That was the pointer.
That was the pointer, that's not the clicker. Oh, there it is. Okay, thank you. So the first thing I'll start out is with community. As you know, since the hurricanes in the Carolinas, we had that national fluid shortage. I'm happy to say that we are back to normal and then some. We've been very fortunate. I've got to give it to Matt Rouse and Ernesto, who are part of our materials management, who are always ahead of the game and looking at things even before we decide to have a meeting about it. And so I've really got to give it to them. They really kept us informed, and we did a lot of ideas. We asked everybody, staff, to come up with ideas to try to stay fluid, and they really did. And there's some things we're just going to keep in place because we feel it's good stewards. So we will continue some of that. But yes, we are out of that fluid shortage as of now. Then we go on to our Women and Family unit, which is our OB, Labor and Delivery. They increased their rate by 5.4% this year in 2024. But if you look over all these years, you can kind of see that our birth rate stays kind of stable throughout the years here. Then the big increase was in our surgical service area. We increased the cases by 13.7 in 2023, 2024. That's an amazing jump, because if you look back at these numbers, 2019 was our biggest to date at that point, and we're even 10% over that. So to go up 13.7, as you can tell, we've had a busy OR. And so kudos to that team.
If I could, I just want to call attention to, this was actually our service goal. So if you remember from our peaks, our one-year goal was actually increasing by 8% year over year. So they've done a fantastic job to meet that goal and provide additional access in this community. So great job.
So Jan, do you think that some of that has been related to the things that they've put in place?
Yes, definitely.
The cards and the council that they have?
Right. So when we brought the Optum Consulting Group in, a lot of the ways that we changed things around, we brought in the PGC, which is our Perioperative Governance Council, which is made up of physicians and nursing, and bringing that council that meets every month to discuss block times. It was mainly block times, and trying to figure out with the block times, how could we arrange those block times to be more efficient, get more surgeries done, but still keep our surgeons happy. So that has been a huge change in the OR, and just overall efficiencies of looking at everything. So it's been a great project. It really has.
Well, tell them the board sends kudos on their job.
Yeah.
How much time are we using over at the surgery center? How active is?
Well, the surgery center, I always kind of look at as a, it's an opportunity for patients to choose that area, but at this point, our OR, our block schedule is pretty full. So without the surgery center, we would not have the opportunity to complete some of these surgeries in a timely manner, because our OR schedule is getting pretty full. Adding on Dr. Hoff, our ENT surgeon, with pediatrics now and doing ear tubes and tonsillectomies. That's just started off. And so by adding those cases without that surgery center to back that off, to take some of that pressure off, we would have a hard time getting these cases done in what the patients feel would be a timely manner.
So what kind of surgeries have you moved from the OR to the surgery center?
Urology is over at the surgery center. ENT, we did do the first month of ENT here to kind of, new surgeon, new ways, kind of want to see. We haven't done a lot of ear tubes since Dr. Chase left. So that was a new opportunity for learning. And they do orthopedics. They have a day a month or a day every other month with Dr. Gustafson, who is a pediatric dentist who has to do some procedures with sedation. So that's done over there. There is pain management that's done at the surgery center. And that's about it. We're looking to do some GYN cases. They do a few here and there, but we're looking at some more cases for that too. So the next thing is we look at last quarter's gain sharing scores. So what we noticed in this when we got these scores just about a week ago was that if you can, I know it's a little small, but if you can see on the inpatient, for the inpatient to go from 92 to 95 is a huge jump. And that's already in the 99th percentile. So to go to 95.1 is pretty much the top. And for them to make that improvement, we see those improvements, sometimes in the ER ambulatory, but to really see that big of a jump in the inpatients was huge kudos to that staff. We've done a lot of different staff modelings over the last I'd say, year in inpatients, like rearranging staff, like how the PCTs, having some leads, how that staff is working in and out together, and being able to, watch the falls and patients who are at high fall risk. But just the overall way things have been done on the unit, I think, is the reason why we're seeing such a jump in the inpatient.
Gain sharing?
I mean, for our gain sharing scores that we report out in every quarter. Yeah.
But what other scores are, is it Press Ganey or is it?
Ganey
Yeah,
scores.
okay.
Yeah,
That's how everyone,
yeah.
thank you. That's
Yeah,
how everyone
sorry, I
would
didn't
know it
put
is
Press
Press
Ganey in
Ganey
there.
scores.
Yeah.
Internally, we have some gain sharing metrics that we look at for this, but yeah, Press Ganey. And I'll also just mention, with that increase that we saw in inpatient, I mean, that really drove up the score of the entire health system when you look at it in an aggregate. So I think we've crossed over the 96th percentile now, so 96.25. So just an amazing work.
It's really incredible.
Yeah. We're all in
concerned at
it
all
together.
about the drop in ambulatory, though, from 98.5 to 98.1? I'm kidding.
Right.
Deeply concerned.
No, incredible scores.
Of course, we'd never like to see it even go down by a tenth. This team is very, very proud of these scores, but
There's not much more room to go up, though.
No, they're very competitive.
Yeah, no, fantastic.
And then on to some more things for our community. So our ASD nurse, Gabrielle Alberti, and Anna McGuire, who's one of our care coordination nurses, so two different nurses from two very different areas, have been working with our high school students on a shadowing program. We had already started this just within the last couple months in Incline with Washoe County Schools, but now they're looking at starting this program with Truckee High. So these students have approval from their counselors, and they'll participate in this volunteer program to introduce them to all kinds of jobs in our system. We're not just looking nursing, we're looking at, what is it like to be a lab tech? What about a radiology tech? What about, starting as a PCT as you decide what you want to do? Do you want to go into nursing? Do you want to go to med school? PA programs, So we're kind of looking at, introducing them to the whole health system as a whole. So obviously, we will start these, our planning opportunities at this point is in med-surg and ICU. With the nurses and the patient care techs, we're also looking at, obviously, the ambulatory OR, pre and post orthopedic office, lab, and a couple more departments. So it's going to go house-wide when they get this program going. And when they come on board, they come on through our volunteer program. They're all, obviously have to have all the regulatory requirements done to come through that program. But we're very excited about this because, like we talked about earlier, that Brian talked about the lab that's going to be afforded by some people, being able to do this and see that they can see kind of where they would like to go in the future is really remarkable for that group.
How large of a program do you think this will become?
It's mainly going to be seniors, high school seniors. And it'll be interesting to see how many, because right now in Incline, I think there's 5. So it's, we're not taking on like the whole senior class.
Because the whole senior class is not interested in healthcare, I can guarantee you that.
Yeah. So we're taking on people that are really interested in healthcare, and it really has to come forward from the counselors. We find that's kind of our best way to vet it, so.
And is there a way that the students come together and debrief on what the experience for that week or that day have been for them and get feedback?
Oh, yeah. They definitely are giving feedback not only to their counselors, but giving feedback to whoever we're assigning them with or whatever. Because they may say, hey, I'm not really interested in that. This is where I'm interested in, and that's kind of what we want to see in the beginning when they come.
Well, when we keep hearing reports of shortages in healthcare workers, I mean, growing your own seems to be the obvious choice.
Yep.
And so I applaud you for that. That's
And we are seeing people that came here as our wound care education nurse upstairs. She was a ER tech many years ago, went to nursing school, then worked and got her 2 years experience in Reno, and then has come back with us. We are seeing that more and more in our system now.
It's brilliant.
So,
Yep.
yeah. And then the last thing I have on here are community healthcare advocates, which some people know them as our prematuras. We have joined them together with the care coordination team. And what this does is better aligns for our providers and our physicians to kind of, hey, I need this kind of help. Is that an RN duty or is that our prematura duty? And for it to be much simpler for the physicians in the clinics versus they weren't sure who they should be going to. We just felt like it was better if there was one stop. They could, make that one referral, and then the referrals decided amongst the group who will be reaching out to that patient, attending those clinic visits with these type of patients. So I think it'll really work out. Service. So for Incline, we have the Tahoe Forest Hospital coverage, which will begin over at Incline. And what this is right now for admissions, we use the Vituity group, our ER physicians, for kind of admitting patients over there. We're going to try to increase our admissions at Incline. So by doing this, we feel like it'll be better served by having our Tahoe Forest hospitalists run this program. So they will begin to call over there and cover patients and be able to, remotely, they'll be able to get the orders going so that patient could be admitted right away, and then they have to see that patient within the 24 hours. So that's would be our planned coverage for those nursing inpatient beds. And then recently we went with Mercy San Juan in Sacramento for transfer process for our nursery babies. When we have a sick baby in our OB, in our nursery that needs a NICU type status, we kind of have to call everybody. Sometimes insurance reasons we can't go to Renown. UC Davis can be very difficult and very full. And so this is another opportunity for our OB patients or for our babies to go. And the good thing about this program, we had a great call with them. They sent us this great video. Our PEDS group will be meeting with them, is that they are one of the only units I know of that as a NICU unit, the mom will be able to, or the father, will be able to room in with this baby, which is not what you see in most NICU services. So we're very glad to have a partnership and a transfer agreement with them. Our ECC unit, which is our skilled nursing unit, has increased their rehab skilled beds. We are just in the final phase of hiring a PT and an OT to support the increase of that, because we currently have 30 custodial beds and 7 rehab skilled beds. Because of staffing, we're really only able to handle 4 of those skilled rehab beds. Now we'll be able to go up to 7. So we're hoping by February to be up to those 7 skilled beds. And every time our med-surg unit gets full, that's where we need these beds, because a lot of these people are not able to go or don't meet criteria to go home. But it's nice to keep them in our community and keep them in a skilled bed here versus having to send them either down the Sac Way or to the Reno Way. And then the ECC is very happy to say that thank you to Dylan's team that they have just had all the heat added to their bathrooms. And it has really, I heard about it this morning when I was over there, that they were very excited that their bathrooms are nice and warm now.
I can only imagine.
Yes, yes.
Can you come to my house?
I was thinking the same thing. So we'll move on to quality. We work out of this area. It's kind of different because the Nevada side works with a different donor service. We're kind of in this middleman area. So we're with Sierra Donor Service, which, believe it or not, is out of the Sacramento Valley area. And so we work hand in hand with them, and every single referral, every single death that we have, we need to report to them within the hour.
Can you expand on this?
Yeah.
A little bit, because I don't think we've ever had a presentation about tissue
And donor services.
and that kind of thing.
Yeah, obviously for the actual organs, a lot of times that's difficult for us because we don't, most of those patients, like our critical traumas, are sent to Renowned. And then if they decide that they could be an organ donor, they've been too critical to be in our ICU unit, so they're down in the Renown market. So we do hear about those. When we do send a patient back, they do let us know that, hey, you cared for this patient, and they'll let us know that they were a donor and what kind of donation was given from that patient, which is really nice feedback to get. But here it's mostly tissue. But the requirement is when we have a death, we have to notify Sierra Donor Services within that hour. That's all we do. Then on the back end, they take care of notifying the family, speaking to the family, seeing what the wishes are, and we don't have to get involved in that portion at all. We will lend them our OR if need be. Our OR team is notified and they bring in their own, but we are notified that they'll be using our OR, but that doesn't happen very often either because tissue doesn't have to be as immediate. So we are required to do this for our accreditation. So like on this last report, we had 6 tissue donors this past year that they were able to use from our patients that we had, from the patients that had died here. There were 6 tissue donors total. So what they do is when you see on this where they say in November we were at 100%, 100% means we notified them 100% of the time in a timely manner. So when we dropped at the 93, what that meant is that we notified them, but we were not in the hour time limit. And we try to have other people help people when this happens, because sometimes the nurse themselves could be too busy with the patient's family, with other things going on. So we try to have a second person, to say, hey, can you at least make this call? All you have to do is make the call, the clock stops. So we are working on that. We want to be obviously at 100%. But as you can see, most of the time we are, but there is times where we kind of fall behind on that notification.
We all hear of kidney, liver, heart, lung transplants. Is that when you were referring to tissue? That's no.
Tissue is tissue and eyes. That's just skin tissue.
Skin tissue.
Yeah, right. Yeah, when it comes to organs, that's mostly done, either at Renowned or UC Davis. So the other thing that's going on in our nursing units right now, and this does affect our anesthesiologists too, is that we are going live with a new IV catheter in February. So our nursing staff and our anesthesia staff have just been recently trained in that. Another thing that we saw with Dylan's team over the last, probably the last year that there was meetings going on back and forth, is that surgical services is going to be adding the housekeeping staff that will be cleaning their ORs as part of their OR department. And this is one of the things that they felt would help that staff to feel like they're part of the department. They're part of just not, cleaning the ORs, but also being, feeling like they're a member of the team, of the OR team. And so that is just going to be starting within the next 30 days or so. We're just finishing up some job descriptions. And so they'll be really integrated and part of the OR team. And I just feel like there'll be better communication back and forth with those people instead of having to go, okay, they have to go over to somebody in Dylan's team, and then Dylan's team's got to, it'll just be, better communication back and forth. So for our ED, our trauma program, we found out over this, it was probably within the last year, that the American College of Surgeons had a standard 5.26 that required all radiology exams to be a final read within 12 hours. And as you know, we go to VRAD after a certain amount of hours. And so this was kind of a difficult thing for us to figure out how we were going to meet this standard, because usually by 6 o'clock or so at night, we were going to PACS. Sometimes they would read later. So we've added hours, thank you to Louis. We added hours to our radiologists, and we now have met this 100% for this standard, that they will be reading exams till 9 p.m., which then gives us that 12 hours, because then they're back reading in the morning again.
I do appreciate that, thank you, but I would be remiss to not mention that we had Scott Baker and both Scott and Dr. Evans heavily involved in that as well. I mean, that was a significant conversation, a lot of great feedback between us and the radiologists, and I'm really happy how that turned out. So it took two willing parties, so we appreciate the radiologists as well on that. But yeah, thanks for that. Thanks. That was a lot of work.
Yeah.
So 10 months ago, the issue was compensation for the extra hours they were putting in. I assume all that's taken care of then.
Yeah, all that's taken care of. So, yeah.
And then we just found out that our ED Trauma American College of Surgeons survey will be in May of 2026. We'll also be with ACHC anywhere from January to June, so we hope they both won't fall on the same day. But the good thing about the American College is they actually let us know the actual date. It's not a surprise, so. And then for people, we just welcomed this week a new day shift nursing supervisor, Christian Hiller, and we wanted to say thank you, and thank you to Alice for being there last night to say goodbye to Laura, who retired after 27 years as a nursing supervisor here at Tahoe Forest. Winter injury case reviews. I don't know if any of you, I think Dale, you have been on them.
Yeah.
They are really interesting. We started back up again this winter. January 14th was our first. Unbelievable cases that day. It is a great collaboration between Ski Patrol, EMS, other agencies, Tahoe Forest, but then we also, like, on certain calls, we have Renown, we have Mammoth. And so it is really a really great informational meeting that we have every month. There was like 210 people on this Zoom call.
Yeah, I even put one on with Casey Jowers.
Yeah.
I convinced him, telling him that over the last 12 years, I've lost 5 friends who have died on the hill at Squaw Valley. In 4 of those cases, older guys making age-inappropriate decisions about where and how they skied. Foolish choices. And so he talked for about 20 minutes about the physiology of aging, and I talked about spreading the word about making good age-appropriate decisions.
Yeah. Yes, they're very interesting calls. I mean, a lot of education.
Yep.
And then our respiratory department has increased training for neonates. So what's to understand in our respiratory department here, these RTs have to take care of anyone from birth all the way to somebody who's dying in their 90s. So their age gap here is really significant. And at most hospitals, if you're a respiratory therapist, you work in the ER, or you work in neonate, or you work in peds. Our guys have got to do it all. Our guys and gals, they have to do it all. So we found that we had some unique opportunities to make sure our staff was feeling comfortable in every entity of their job. So recently we have really done some huge education on the neonate side to make the staff feel more comfortable. And we're very thankful to have one of the nurses from UC Davis that comes up and really helps teach that part of the neonate with these RTs. And we also include our pediatricians in this too. So it's everybody training together so everybody understands whose job is what when we have a sick baby on the unit. The ED has just begun work towards what we call, it used to be called HVAP. So they are looking to do a primary stroke certification. This will be a pretty daunting process. It will probably take us a year or two to do this. We have Dr. Abby Young, who is now our stroke program director, and Julie Morgan is our stroke program coordinator. And so between the two of them, we will look to see what needs are required for this stroke certification and start to work towards that program.
Can I ask you, the 2 individuals that, excuse me, you have mentioned, is this a dyadic relationship? What we've come to know as a dyadic relationship?
I would say it is. I mean,
It's a little different.
yeah.
Okay, yeah. So we have dyadic relationships for the service lines. This is a clinical diagnosis. This is stroke. This is one aspect of neurology care, and it overlaps some different service lines. But there are operational people in the emergency department and also in the inpatient areas of the hospital and in radiology that are involved in their operational leads. But it's not just like a service line where there's one operational director and one clinical director working together. It's more of a team kind of situation. So it's a little different. So there's, one thing that would be analogous to this would be like the trauma program. Trauma is not necessarily a service line, it's more of a collection of conditions that people present to the hospital with. And stroke is one narrow area, but it's so impactful that many hospitals like ours are approaching it in a very comprehensive way. Hopefully that made some sense. Okay, all right.
Thanks, Brian. And then next, Mercy Epic. As you know, our Epic program, we are under the Mercy umbrella, and they have invited us to participate in a pilot project regarding AI generated end-of-shift notes. So currently, our end-of-shift notes, which our hospitalists are very happy to see every day and let us know when they're not seeing it, is that this would be AI generated and it would be taken off the notes throughout that shift, and the nurse wouldn't actually have to go in and write this note. So this is something that obviously the nurses will be very happy about, but we're glad to be a pilot in this program because we want to be able to provide feedback and make sure that this AI is correct going forward, because we did have an AI's fall program that rolled out probably, 6-8 months ago, and it was a little difficult. So I feel that by us being able to have the feedback in the moment and not have to wait till we see that there was scoring issues, that we'll be able to use this much better. So they're pretty excited about this, and we'll see how it works, so.
And is the plan, if the pilot is considered successful, would we then adopt it as?
Yeah, we'll have the
practice?
opportunity to adopt it then.
Okay.
Yeah. And then the last is our finance. We were very fortunate in the last year to be able to take Jenny Parvin, who was our ICU manager, and she became the revenue integrity RN. And this is thank you to Crystal and her staff, that Jenny has been able to work with that staff. She is over currently at the Pioneer, and she's been busy working on with multiple teams, mainly with Crystal's finance teams, and she works with the coders. And in the past year, she's really become educated. She attended conferences, training. We had our group, Moss Adams, just recently work with Jenny, and for her to be able to get all the training and really be able to be involved in the issues that we are seeing, like with billing compliances, our hospital making sure charging our documentation supports our charges. And then she's able to not only report back to nurses, physicians, and Crystal's group, and they're able to work together on the workflows or the documentation. So far, we have really seen that this has gone well, and we're excited that she's in that role and being able to move forward with some of these issues we've been seeing.
I like it too because she was part of high reliability.
Yeah,
And
she
so
still
we
is.
can take that and use it in her new role.
Yeah.
Yeah. Crystal, is this helping our ER efforts, our AR efforts, I meant?
So really what Jenny's been working on with Moss Adams is creating a revenue integrity program for the district overall. And working with Moss Adams, we're able to kind of adopt best practice instead of kind of doing what we think should be done. We're learning from support of the healthcare consulting arm of Moss Adams, who happens to be our audit firm too, but they're totally separate. It's really creating a denials management committee and a process to follow so we can track, trend, fight denials where appropriate, stop denials from happening upstream, that sort of thing. Charge capture, charge entry, clinical documentation, coding. She's got a list of about 6 key areas charge master compliance, making sure the charge master codes are up to date. So she's really spearheading bringing best practice in with Moss Adams to create this area. She will need support. She's been excited to learn and grow and develop this programming. And so she's been she's a sponge. She just wants to learn and create best practice for our organization. So it's been very good. It's still relatively new, so I couldn't tell you statistics. So she dropped our denials rate from this to this. Eventually I will, but it's still getting off the ground with data and policies and procedures and building committees and that sort of thing. So, but it's been great.
Yeah. Oh, good.
Thank you, Crystal. So that's it.
Wonderful.
Any
Thank you very
questions?
much. Yeah.
Thank you.
I was just wondering, Jan, about the inpatient census, because, for a while, the ICU was closed for several days, and, moving around of staff so that everything was covered, and then we got all the respiratory problems, and
And we're full.
the beds filled up, and the nurses got sick, and so I wondered how that has gone this winter.
We've had some days that were challenging. We've had days where we've had no beds, and the ER did have to hold a patient not for very long, 10 or 12 hours. We have had challenging with staffing, and what happens with that is we're very fortunate to have our break nurses. So when things happen, we have our break nurses in staffing, we have our managers in staffing. So we were able to get through that probably 3-week period at the worst time at Christmas time when everybody got sick, and then you also have people off too. So we made it through. It wasn't easy, but somehow we have absolutely unbelievable staff that always steps up to the plate.
Do we have travelers at all in any
No.
of the departments?
No travelers in nursing at all.
In nursing, but in other departments?
I'm not sure about other departments. Nursing or respiratory, no.
Okay.
It's very rare. We do occasionally have travelers in other departments, other service lines, but I'm amazed on how little we use travelers comparatively to the rest of the healthcare market in California, particularly. We've done a fantastic job, and I think that's something that goes to speak to just the reputation of the health system as an employer, and we just are really fortunate to have that where people are interested in being employed here. So that's a really big plus for us.
Any other questions, comments? No? Audience input?
Hi, I'm Megan Shirley, for those I haven't met. I'm a PA here at Tall Forest. I had a question for you guys about Jenny's role, which I'm excited about. Is the plan that she'll cross over into outpatient billing as well, or is it just focused on inpatient, or is it all already?
District-wide.
District-wide. Okay, that's great to hear, because I work in outpatient and we need help. I know. It's a starting point, right? Great, well, that's good to hear.
Thank you, Meg.
All right. Any other input? No? Jan, thank you very much.
Thank you.
And again, that was an item just for board discussion and presentation, so no vote required on that. Next item is for board action, item 16.1, President and Chief Executive Officer Employment Agreement. We are very pleased as a board, after an extensive 6-month search with incredible support from Whit Kiefer. And I think maybe to our surprise, maybe not an incredibly qualified pool of candidates. It was incredibly tough to even narrow the list down. But we did. And we have made an offer to Anna Roth, who is or has been currently the CEO at Contra Costa Health System. She's been there for the past 15 years in that role. Therefore, extensive California healthcare experience as well, which was something that was very important to us. Clearly she brings extensive management experience, but one of the areas I believe we were really impressed was the extent of her work and success in community health, community engagement. It was central to her role, but also just something she is very personally passionate about. And we look at, our fifth peak that was growth and is now community. Clearly, it's a centerpiece for what we were looking for in the new CEO. She also started her career as a nurse, which was something we really appreciate as well. So not only deep, administration and management experience, but she's been on the caregiver side as well and brings that experience to the table. Alice and Mary really led the discussions with Anna, so I've an opportunity for you guys.
I'll defer to Alice because
Okay.
she sort of led the.
I'd like to start, though, just talking about the board search committee, and I want to really put a thank you out to Crystal and to Dr. Koch for participating. It takes a lot of time, and it takes a lot of thought as we were going through the resumes, but I think as we went through them, we really got excited about what is out there leading healthcare. But what we had to look at was how to make it attractive to our candidates to come here, not just that we have a great health system and we look good and our buildings are close and our staff are congenial and engaged, but also, what is it that's going to attract her to come benefit-wise, finance-wise, et cetera. So we worked very diligently on our contract, our employment agreement, and we had great discussions with Mark Adams, who was our Whitkeefer representative, with Human Resources. We looked at the agreements that we'd had in the past, looking at what was particular for a CEO and what was more of the general for all CEOs. So I think it took a lot of time and a lot of work, and I really want to thank the board and those who helped us with that. But again, what we did is we took what was the range of pay for a CEO, and we offered that. We took the middle line and actually was in agreement with the candidate in the amount. There were questions about travel, getting up here, housing, and all of that was taken care of. Our human resource worked with her on that. And what we did agree to, and Ted Owens and his department worked on a release of information so that Anna, as well as Tahoe Forest, could put out the information that was the same and also at the same time, so that everybody got it. And I'm hoping that it's going to go out tonight to our staff.
Yeah, Ted, do you want to speak to?
Thank you, Chair McGarry. In an agreement with Ms. Roth, it will go out tomorrow morning at 7:30.
Now,
And to the public at 9.
and to the public, yeah. Employees.
Yeah, so if the employees are listening, you heard it here. First, yeah.
Heard it here first, yeah.
And if you guys are finished through the chair, it is required that we provide a brief oral summary of the terms of the agreement that's being approved. So with your indulgence, I would.
Do you want to get agreement? We just read the headings of it. Do we have a copy of the agreement?
I was just going to highlight the
Up to-
term and
Yeah.
the
You have.
salary and stuff. Yeah.
Yeah.
Oh, you wanted,
Yeah.
Is it?
Yeah.
Can you present?
I can
that?
provide that if
If you have it ready, then.
the chair's
Please do,
discretion.
yes.
I mean, it's a term of 3 years, with a start date in March 10th. It's our standard, it's the standard CEO employment agreement. The salary would be $750,000 a year, including an incentive compensation plan that would allow for additional compensation up to 30% max, with a target of 20% of the employee's base wage. And then all the other sort of terms and conditions are those that would apply to department heads. And it's an at-will employment with our standard provisions regarding severance, et cetera, that was equally applicable to the prior CEO.
Okay, thank you. I believe, Alice and Mary were involved in the discussions. Every board member has had the opportunity to review the agreement. Any questions or comments? No?
I would
Questions
also
or
just
comments
add
from the
that
audience, yeah.
we did get some input from a third party on the wage to make sure that it was in line with market. Future Sense, what's their new name? Alliant.
Yeah.
Thank you.
Thank you, Alex. Any additional questions or comment from the audience? Then I believe we'll move to a vote. Can we get a motion to approve the employment agreement for Anna Roth?
I move that we approve the employment agreement for Anna Roth.
I'd like to second that.
Thank you. We have a motion and a second. I don't know if a roll call vote is required here, but I think it would be appropriate.
Director Chandler?
Yes.
Director Brown?
Yes.
Director Wong?
Yes.
Director Darzinkovich?
Yes.
Chair McGarry?
Yes. All right, motion approved, 5-0. Thank you, everyone. And thank you to all involved in the process. It was lengthy. I know to those that weren't directly involved in the process, it might have even seemed like it took too long. But we worked to an aggressive schedule, and at least relative to other CEO searches for, at least corporate searches, things I've been involved in, this did move along at a pretty rapid pace. So pleased with not only the outcome of it, but the process in general, and a big thank you to Whit Kiefer as well. I think we got time.
Yeah.
I'm very excited about having the new CEO start at Tahoe Forest, but I really wanted to thank Louis for providing leadership during this time frame. He's been stellar in helping us hold fast, and he really deserves some kudos here. So thanks, Louis. I appreciate your leadership.
Thank you for that. Now, he's still going to be leading us, though, for 2 more months, so we're not going to let him go just yet. But yes, I think we would be remiss to not acknowledge that now and again in the future. So with that, item 17, there were no items pulled from the consent calendar. Board committee reports. We had a finance committee, hot off the press yesterday.
Off the press, yeah. Turn this on. Yes, we did have our very first meeting in our new configuration and our new membership. And I want Dale to know that we opened the meeting with many words of thanks and appreciation to you for your, was it 12 years you've been on the Finance Committee?
Well, 1 year I was chairman, so
Yeah.
I missed one of those years.
Well, you certainly led the committee through many years of downs and then ups. And so thank you for all your hard work and dedication. So as this was the first meeting, we just were sort of feeling ourselves out and are going to continue to have the conversation about where we want to find our areas of focus. There are so many choices out there, so many things that we can be looking at, but we want to focus on those that are most important and most impactful. We did spend an inordinate amount of time talking about our accounts receivable because that's sort of been our soft spot in an otherwise absolutely stellar financial picture. And so we did spend a great deal of time because it's complex. There are so many internal and external factors that affect the AR, and the AR affects so many other things as well. So we did spend an inordinate amount of time talking about that. When we got down to the financial statements, of course, we had another amazing month. So that was great, and kudos to everybody. We talked about a couple of potential threats, new potential threats to our financial stability. And those would be around the two different issues of charity care and I don't know how I would phrase it. Crystal, you can, how we deal with bad debt. We can only go so far in terms of trying to collect old debts now. And our hands are really pretty tied going forward, and it's just going to be the way we're going to have to live with it. It's a new law. It's been put into effect at the beginning of this year, and that's it. The other thing, the big elephant coming down the pike is the Office of Healthcare Affordability, which is supposed to be in place at the end of this year. Again, Crystal, correct me if I'm wrong on any of this, but they're in the formation, they're starting to figure out what they're going to do, how they're going to do it, and it could be an enormous disruptor for the hospitals in California. And so we're going to keep abreast of all that's coming along, and we're trying to figure out the best way to keep the board informed of what they're doing and what the impact will be upon us. So that was a great deal of discussion. We had what I always find to be a very engaging report from Chandler Investments. She talks so wonderfully about the national economy and what's happening, and what reports to look at, and this, that, and the other thing, and how it's going to impact us. And right now, we do find that our portfolio is in great shape. We're very pleased with all of that. And when we challenged, her name is Elena, about the future as far as we can see it right now, she says, and I thought it was a wonderful, wonderful quote, that Chandler is positioned for uncertainty. So I thought that said it all. So that concludes my report, but I'll entertain any questions anybody might have.
I'll just build on your last comment, and that is, I've tried to keep up just in the last 48 hours of the executive actions that have been taken. Change and uncertainty, I think, is definitely in our future, and I think it's a request, maybe even a plea from the board. If there are things that we should be aware of, I mean, clearly we're trying to do our best just as individuals, but if there are things that we feel would directly affect our health system, you know where to find us. Please don't hesitate to reach out and share, even if you think it's something we might already be aware of. I think definitely for the foreseeable future, the next 6 to 12 months, I think we're going to see some rapid change that could have direct impact on the work we do. And I don't mean that to be both positive and negative, right? So I'm not making a political statement here, but change is going to be happening. I think we've been warned of that. So any other committee reports? Is there a foundation?
The foundation and Incline met. Their last big project was a mammography, and prior to that, the CT scan, all developed with philanthropic dollars, which is truly amazing. So they're kind of taking a rest at this point right now. Nothing of note.
Okay. Thank you. Board member reports or closing remarks? I have one.
Go.
Yeah.
Was it going to be the same?
I have a remark too.
Oh, well, mine, of course, is in public recognition of the fact that this board probably would have crumbled if we did not have Martina. And as I think everyone may or may not know, this is her last board meeting. She was kind enough to even extend and make sure she was able to attend and prepare us for this meeting. So we do have a little something for you from the board. But thank you for everything you've done for the board, I know for me personally, in surviving and thriving on the board, and I know everyone else feels the same way. So, any other?
Go ahead.
May. Okay, Martina. So I was thinking about all the ways in which you impact, you're turning red. All the ways that, you have impacted us and how we can possibly ever express our appreciation. And I figured I only have words for you. And so I thought, well, how do I do this? How do I tell you in all the many ways you've done this? And then I thought about Elizabeth Barrett Browning. And I thought, how do I love thee? Let me tell you how. And so, or let me count the ways, I guess it was. So anyway, this is my version. This is Mary Elizabeth Barrett Brown. And this is my sonnet to Martina. I'm not getting on my knees. So, it's a sonnet for Martina. How will I miss thee? Let me count the ways. I will miss thy ability to anticipate our every needs before we know they even exist, thereby making each of us appear a little smarter than we really are. I will miss thy ability to prevent a Luddite like me from bringing down the entire Tahoe Forest IT system every time I need to change my password. I will miss thy ability to speak with thine eyes. Your eyebrows alone have vocabulary, and they may even be multilingual. I haven't even gotten to the eye rolls yet. So it's quite remarkable. I will miss that thy heart gets filled with kindness and good work for the staff of Tahoe Forest every holiday. During the merriment of the holidays, you are thinking always of others. Thy art the star upon the top of the angel tree. I will miss thee for so many more reasons, but mostly because thou hast become my friend.
Hey.
I should have gone before you, Mary.
Does anybody dare go after that?
Holy cow.
I think Mary did sum it up. I just have to say that indeed Martina always anticipated us. She knew where we had the weaknesses and would remind us not to do such and such, or you got to remember to do such and such. And the fact that I could send an email or a text to her on a weekend and actually get an answer on the weekend, I was always amazed by that. I think I'd probably get it on Monday. She was there for us 24/7. We are a board because Martina was our clerk, and we appreciate everything that you've done. We will miss you greatly, but we know where you live. So thank you again, Martina.
I've got a little something to say, too. Obviously, all of these hospital board members appreciate how you have helped, guided, and even at times led us in our achieving our goal of making this the finest mountain health care system in the nation. You are a crucial contributor to our success, and we wish you all the best in your next career endeavor.
New guy goes last.
Bring us home strong, Rob.
Yeah.
6 weeks, 7 meetings, you're leaving, the holidays, and yet I've had such great treatment, I can't thank you enough. I felt like my onboarding's been seamless, continues to be seamless. You've handed it off well. And I have the same exact example. I was sending an email to you, and it's like, I'll time it in the morning. I sent it accidentally in the evening. It's like, I got to reply right away. So thank you. What I'm excited about is that you have another chapter. I know that you'll serve Truckee well, that they are blessed to have you, and you'll, again, just make this town amazing. So thank you for all you do.
So Sarah, are you prepared for this 24/7 treatment?
She lives in Sierraville. She can get away.
We've-
Trying to fill her shoes.
Yeah.
I'm not sure it's possible, but
Yeah.
do my best.
Okay.
You will.
Any general comments? Let's see if we can turn more red. It's now a competition.
You know, I wasn't completely prepared to do this.
Do you have a song?
Well, no, I don't have a sonnet or. I really can't put into words how much Martina has meant to me personally when I onboarded here at Tahoe Forest Health System. That was a scary time for me professionally, but also for my family who was trying to engage here in Truckee. And Martina really went out of the way to make us feel comfortable as a family. She's not only a coworker, but she's a friend. I wish her the very, very best. And on behalf of the entire team here, she's just been such an amazing coworker, amazing part of our team for many years, and we just wish you the best, Martina.
Okay.
Okay.
No more closed session, no more open session. Meeting adjourned.
Nice going.
Yeah.
Nice going, boss.
You made me cry.